erectile dysfunction is more prevalent than many realize. Over half of men older than 40 experience some form of erectile issue, with the likelihood increasing as they age. Although it can also affect men in their 20s and 30s, this condition can severely impact a man's well-being. Yet, a surprising number of men do not seek help. According to one industry survey, only 51% of men with erectile dysfunction have discussed it with their doctor, and even fewer have talked about it with their partners. There isn't a medical condition I'm aware of that affects more men's lives, said Dr. Mohit Khera, a urologist and president of the Sexual Medicine Society of North America. However, effective treatments are available beyond well-known medications like Viagra. These include vacuum pumps, injections, implants, lifestyle changes, testosterone replacement therapy, and sex therapy. Experts suggest that a combination of these options can almost always improve erections, even in severe cases. Before men consider pills or pumps, or natural male supplements sold at gas stations, they should undergo a health exam to identify the underlying causes of the dysfunction, which could indicate a more serious health issue. The penis can be seen as a barometer for the person's overall health, said Dr. Rachel Rubin, a urologist and sex medicine specialist in Maryland. Why erections sometimes fail. When men become aroused, the brain releases chemicals that cause muscles to relax and blood to flow into the penis, resulting in an erection. Various factors can disrupt this process. Clogged arteries and high blood pressure can impede blood circulation. Neurological diseases like multiple sclerosis and Parkinson's can interfere with nerve pathways. And pelvic trauma from surgeries, radiation therapy, or injuries can damage penile tissues. The frequency and severity of erectile dysfunction vary widely. Some men experience occasional issues, while about 5% of men aged 40 and older have complete erectile dysfunction. Some may wake up with morning erections or achieve them during masturbation, yet struggle to maintain an erection during penetrative sex. Finding the right treatment plan. There is a growing appreciation that individuals may have very different expectations for their erections, said Dr. Petar Bajic, Director of Men's Health at the Glickman Urological and Kidney Institute in Cleveland. Consequently, there is no definitive rule for when men should seek treatment. Some may wish to have frequent penetrative sex, while others may be content with erections sufficient for masturbation. If you are not maintaining an erection satisfactory enough to do what you want with it, then it's worthwhile to talk to a physician, Dr. Rubin advised. The first step is to consider lifestyle modifications. Obesity, smoking, alcohol, and recreational drug use are all known contributors to erectile dysfunction. Dr. Khera noted that a healthy diet and regular exercise can sometimes enhance erection strength without additional interventions. It's also crucial to explore potential psychological causes, such as stress or depression, especially among younger men. One study found that psychogenic dysfunction accounted for over 85% of cases in men under 40. Additionally, review any medications you are taking. Some prescription drugs, including specific antidepressants and finasteride, used for enlarged prostates and hair loss, can contribute to erectile dysfunction. By considering these factors, physicians and patients can collaborate to develop a treatment plan that incorporates lifestyle changes and potentially one or more treatment options. Oral medications. Currently, 4 oral prescription drugs are FDA approved for treating erectile dysfunction: sildenafil, Viagra, tadalafil, Cialis, vardenafil, Levitra, and avanafil, Stendra. These drugs function by relaxing muscles and dilating blood vessels to enhance blood flow. While oral medications are highly effective, they are ineffective for about a third of patients, typically those with the most severe cases. Cheaper, generic versions of Viagra and Cialis constitute most erectile dysfunction prescriptions in the United States. Viagra is more effective on an empty stomach and lasts 3 to 4 hours, while Cialis should be taken with food and remains in the system for up to 36 hours. Smaller doses of Cialis can be prescribed for daily use. Telehealth platforms like Hims and Roman have become popular ways for men to access oral medications, partly because they allow men to avoid awkward, in-person discussions with doctors and opt for mail delivery. Although prices may be inflated, obtaining medications through these sites is acceptable, Dr. Rubin stated, provided that men also establish a relationship with a doctor familiar with their medical history. A 2020 study found that some direct-to-consumer companies only partially adhere to the American Urological Association's screening guidelines, meaning underlying physical and mental health contributors can go undetected. Vacuum devices. Penile vacuum devices, or penis pumps, are an effective, non-invasive option, particularly for men for whom oral medications are ineffective. These devices increase blood flow to the penis to achieve an erection, which is maintained using a constriction ring at the base of the penis and scrotum. For about $300, men can have sex whenever they want, for however long they want, Dr. Kara said, referring to medical-grade devices. While effective and suitable for some patients, others find them cumbersome, as they require a little bit of drama each time they want to have sex. Injections. 2 drug mixtures, Bimix and Trimix, also induce erections by enhancing blood flow. Patients administer these at home after initial in-office instruction from a doctor. However, they must inject them directly into the penis 5 to 20 minutes before intercourse. They're usually like, "Wait, you want me to put what where now?" Dr. Rubin remarked. Despite this, injections have been used safely and effectively to treat erectile dysfunction since the early 1980s. Unlike oral medications, they cause erections regardless of arousal. Testosterone. Replacement therapy. Low testosterone levels can reduce sex drive and weaken erections, though this is rarely the sole cause of erectile dysfunction. Over time, hormone deficiency can lead to penile tissue atrophy, making erections even more challenging. The condition is treatable with testosterone replacement therapy, which can also enhance oral medication efficacy. However, it is essential to work with a doctor to monitor the condition. Implants. Penile implants, available since the 1970s, were the first major treatment for erectile dysfunction and remain effective for men who do not respond to or dislike other treatments. Although